Hi everyone, welcome to Lipstick and Lipo. This is our fourth episode. We're so excited. We're going to be talking about something a little bit more different today. We're going to be talking about breast augmentation. So I'm just waiting for Ashley Amalfi to get on. So let's see. Hi everyone, thank you for joining. I am just waiting for Dr. Ashley Amalfi to be joining us. We're going to be talking about breast augmentations today. So if you guys have any questions, shoot them over and we will do our best to answer them. Let's see where she is. There she is. Okay. Hi guys. Thanks everyone. We're so excited to be doing this week. I think the 8 o'clock time worked well last week. So, hi.
Hi, girly.
How are you?
I'm good. I'm on the porch and there's no kids, so I'm really excited for tonight.
Fantastic. Does
It's
Tom
gonna be
have them?
great. Yep, they're with
Fantastic.
Daddy.
Perfect.
So I'm excited. So we're gonna talk about a procedure today. We're gonna do something a little bit different, and people
Yes.
seem really excited about it.
I think so too. And I think it's like perfect timing because both of us have noticed different trends with this procedure over the past, pre-COVID versus post-COVID, I think. So it'll be interesting to talk about. We're getting some people on here, so that's exciting. And let me just set the timer. We're setting a timer, guys. We're going to keep this to 15 minutes. So if you start hearing a beep, that's what it is. All right.
Awesome.
Perfect. Should we just get started?
Yeah. So let's talk about
Okay.
trends because
Yeah.
we were talking last week about like what kind of things we were seeing more in our practice with COVID, and breast augmentation by far is the most common thing that I've been doing since being back. But that's
Yeah.
kind of changed from what we were seeing pre-COVID. And you and I have talked about this. So
Mhm.
what are you seeing in your practice?
Right. Well, I think we both know, and most people know that breast augmentation, liposuction, those are pretty much the most common plastic surgery procedures year after year. But we, noticed, especially the past year, those numbers have gone down for breast augmentation. I think there's been a little bit of a scare in the public with breast implants and some of the things that they may be associated with. So in my practice, I've been actually noticing more people coming in to get implants removed.
Yeah.
Or if they wanted augmentation, they were kind of shying away from implants and preferred fat augmentation.
Yeah.
So fat transfer. But like you said, post COVID, that's changed.
Hmm.
I still do see patients coming in for fat transfer instead of implants, but the implants numbers are going up
Yeah. It's exactly the same.
significantly.
Yeah. Same for me.
Um,
So we're still doing fat for patients who just want that natural breast augmentation, but a lot of implants. And I think that like there's good real information out there and people realize that implants are safe. And so I think we're learning more about, ALCL, which is what the concern is. We're learning what kind of implants are associated with that. And most importantly, what implants are really safe and have like a
right,
proven track record and are FDA approved. And so I
right,
think once people are getting information that no, there's great smooth around implants out there that have, never been associated with these things, then people are comfortable and they're moving forward. I also see people, I think people are just, in the last couple of months, they're thinking about these things that they really, really want. And if they've really wanted that breast augmentation, they're like, you know what? Life is short. This is something I really want. And the minute that it's an option on the table, they're just going for it. And it's so cool. It's so cool to give someone something in such a simple operation that they've been thinking about for years.
exactly. And to just for people who don't know what ALCL is, so that's a rare type of lymphoma that's associated with textured implants only. That's all
Yeah.
we know so far. It hasn't been associated with smooth implants.
I brought implants
There you go.
outside.
So yeah, so that's the textured implant where there have been cases of ALCL reported, and then those are the smooth implants where we have no cases reported. And so those are completely safe. They're FDA approved.
Yes.
And that's what I routinely use in my practice. I know that that's what you use.
Yeah.
But I agree. I think once and I always bring it up to patients because I don't know what they're reading, because there have been articles in the New York Times, there's tons of information on the internet. So I bring it up first. I talk to them about it, and just kind of ease, because it's always in the back of their mind, I think, and maybe they don't want to talk about it necessarily. I think you're frozen, Ashley. I'll keep on talking. And to comment on what she was saying as well, as far as people just wanting to do something for themselves, I think the time in quarantine, people have been able to sit in front of the computers that I've read. We lost her. Hopefully she'll come back on. So there's actually been studies that show that it takes about 1 year for patients from when they start thinking about surgery to when they actually have their surgery. And so a lot of that time is doing research and talking to people and having different consultations. There she is. So that kind of, quarantine sped that process up, I think, a little bit. So there you are.
I'm still listening to you. I'm sorry. Maybe the porch is not a great idea.
Yeah.
But it's fun.
Well, it's beautiful though.
Well, thank you. It feels nice.
Yeah, exactly. So you heard me.
I was listening to you, and I feel like people have used COVID as like that time. Like they've really been thinking about it and researching it. And I think you do also see a difference between breast and body patients where breast and body patients make a decision kind of quickly. Facial patients think about things a little bit longer. They plan it for years. And so you're almost seeing that immediacy with the breast and body surgery right now. And that's why we're seeing this huge rise in breast augmentation.
And I think also for breast augmentation in general, the procedure is relatively smooth. The recovery is quick. So right in this time frame where people are not really sure what's going on with their jobs, maybe they're going back to work soon, maybe they're not, they can really get this done and recover quick enough to get back to work.
Yeah.
So I think that that's another thing why we're seeing breast augmentations, those.
Yeah. I mean, if they're working from home, so breast augmentation is like a 1 hour surgery, super fast outpatient surgery. Patients go home and they feel good that night. I mean, I have patients who go to I had a patient
go to dinner.
Yeah, they go to dinner.
Yeah.
I had a patient who went to like a cocktail party the next day in like this tight little dress, and I was like, that's amazing. I mean, it really is a very straightforward surgery, and people do really well. Exactly. So it's a perfect time. It's a quick recovery, and I think that's why we're seeing this rise. One of the questions people were asking today is how do you know who's a good candidate for it? And a lot of women want to know, if you haven't had children yet, should you have a breast augmentation or should you wait until after you have kids? And what do you think about that?
I mean, honestly, I kind of just ask them what they want. If there's no reason to not do it before. Having their children, you might as well enjoy it, and if that's what you want, but I do have a conversation with them about breastfeeding, just because a lot of people either can't produce enough milk and have to supplement with formula. And so I kind of gauge with them how important breastfeeding is. And in their mind, if they have to breastfeed for 6 months, a year, whatever it is, then maybe I'll kind of push them towards waiting. But that's really the only thing. How about you? What do you tell patients?
Yeah, same. And I tell them that it's perfectly safe to breastfeed with a silicone implant, that, there's not any more silicone in the milk of a breastfeeding mother with an implant than there is in a formula. And so
we actually have studies that's all been studied.
Yeah, it's crazy, but it's true. And so that makes, I think, people feel really safe. And I think when you think about breast augmentation, I see like two populations. I see women who are younger and probably haven't had kids, and they have very small breasts, and they've always had small breasts. And they're very perky but very tiny. And so the breast augmentation for those patients, usually they get a breast augmentation earlier in life.
Right.
And then I kind of see this other population of women who've had kids and they're new moms, and they've breastfed and they've lost volume. So after they breastfeed, they have that kind of concavity to the upper pole of the breast.
Right.
And that's what an implant gives you. I mean, the implant is round, and I mean, even though it assumes a teardrop shape with gravity, that upper pole fills the upper pole of the breast that they lost after they had their pregnancies and breastfed. And so that's totally fine to do, you know, after kids, before kids. But sometimes when we see moms after they've had children, then they might need a lift too. And those are very easy surgeries to do together.
Right, exactly. And, you know, and some people might not even want the implant, right? Because their breasts have changed so much that they just want that lift, and they kind of want things back up to where they were before as best as possible. But yeah, I think it's all a matter of kind of the shape of the breast and how much loose skin there is after pregnancy, and whether an implant's enough or you really have to remove some of that extra skin. But it's an easy procedure, and patients recover so well from all of these breast procedures, even breast reductions. I was getting some questions about breast reductions, which we could talk about at another time, but definitely.
So let's talk about recovery, because I got a lot of questions about that, and we're being very conscious of timing today.
Yeah, we are. And we just have another question here, which we'll answer about fat transfer.
Okay,
so
cool.
We'll bring that up later. But yes, recovery. I mean, I think it's one of the quickest recovery procedures, really. You know, it's a quick 1-hour surgery, like you said. Patients are going to dinner that night. You know, do you teach them exercises to do for their implants?
At the end, when they're like 6 to 8 weeks out, I do like some implant massage.
Okay. I usually have them start a little bit earlier with the massage, just because their implants are so high riding.
It helps it come down.
It helps it come down and settle out. So, so we're talking about, you know, massaging the implants and kind of moving them around in the pocket, so that they obtain a more natural shape. But yeah, I mean, patients go back to work after a weekend. You know, if they have surgery on Friday, they go back on Monday. I do, you know, kind of shy them away from going back to their, like, Barry's boot camp and all, you know.
Yeah, I do too.
They can do light activity, but I just really don't want them jumping around and doing all that strenuous stuff until things have healed up.
Yep, I do the same. I tell them walk first, then run. And then, you know, at 6 weeks, you can be back to doing whatever kind of exercises you were doing before surgery, but it's kind of like a slow ramp up to there.
And listen to your body. I always tell them that no matter what restrictions I give you, your body is going to tell you what it's happy with and what it's not. And you have to listen to it.
Yeah, and you have to wait till the next morning, just like a workout. You're not going to feel it when you do too much. You're going to feel it the next morning when you overdid it. So I tell them to kind of go slow. We're just the same.
I know. But yeah, so how do you, I know we got some questions also about implant choices, how to choose your implant. Sizes. I know we're running out of time. I feel like I'm watching the clock right now. It's so stressful.
So, I mean, I think implant sizing is so critical, because that's how women can have a beautiful, natural looking breast augmentation, or they can have like a really raunchy, overdone looking breast augmentation. And so measurements are so important. So when they come to the office, we take very detailed measurements, and then we choose an implant based on how many cup sizes they want to increase, but we choose, most importantly, an implant that fits their chest. So an implant that's too narrow is going to look like a torpedo on your chest, and an implant that's really wide and kind of covers your arm is going to make you look really top heavy, and no woman wants that. And so we choose
a lot of problems down the road, right?
Oh, absolutely.
5, 10 years, it can really cause a lot of complications that are at that point pretty difficult to fix. So we want to make sure, like you said, that it fits their body.
Yeah. So it's a good thing it's fun. I mean, we try them on physically in the office, and then we choose something that fits within their anatomy. And we always get it spot on. And if they're unsure, then they come back and we resize again. But It's kind of the fun part of it. So everyone loves it. And then
I know they get
patients,
so happy
it's the
when you
best
leave
because
them in the room with the
you just
sizers.
see what you're going to
Yeah,
be. I mean, it's like such immediacy. And so people love that. So
right.
that's really fun. We
Okay.
should talk about fat grafting real quick, but that might be a good topic for the future too.
I think so too, because I feel like there's so much we could talk about. But I know you do a lot of fat grafting in your practice. I always tell people that it's more of a breast boost when I do that for
Oh, I
patients.
love that.
If they, yeah. So I'm like, okay, I'm not going to get you the 2 or 3 cup sizes bigger that you want. If that's what you want, I can reliably do that with an implant. But if you want a boost, you want something natural, then the fat transfer is the best way to do it.
I
I
totally
think.
agree.
Yeah.
I say the same thing. I say like implants, fat grafting to your breast is going to fill out your cup size. So when women get like the
Mm-hmm.
gapping of the top of their breast, especially after having kids, the fat grafting is going to really boost that up. I love that word. I'm going to
Yes.
use it. And then if you want to increase your cup size or you really want a prominent upper pole fullness, the only way to achieve that is with an implant. So they're very different operations, but it really just depends on what the woman is looking for.
Right. And a lot of people ask if the fat transfer is permanent, which it is, but we lose about half of it almost over 6 months
Yeah.
to a year. So
Yeah.
whatever remains is permanent.
Yep. Yep. And that's what I tell them as well. And some people just need a second round of it. And if they're really determined to just have a natural augmentation and enhance the shape that they already have, they're totally, willing to do that. And that is a super straightforward surgery, easy recovery. The
Right.
liposuction is sore and that's it. I mean, you just kind of go
You
on
don't
with
feel the
life.
breast at all. Like there's
Nothing.
really no pain on the breast. It's just
No
from where.
incisions, nothing. Yeah. Very, very straightforward.
Yeah, absolutely. We literally have 32 seconds.
We did so good.
I know. Do we
I
answer
think
everyone's questions?
I think we really did. I mean, the one question we got about is cost, and I think we should,
Okay.
I think there's a big range for this, and I think that the most important thing. So, I mean, I think a breast augmentation can probably be as low as like $5,000 or $6,000, and as high as probably 10 or 12.
Yeah.
And if you have a lift or a lift of any kind with that, then that would increase the cost, and that's for fat or implant. But I think the important thing is that like this is about certification and finding someone who's qualified and experienced, and you need a board certified plastic surgeon to be doing procedures like this. So this is not about price shopping and bargain shopping. You're going to get what you pay for. And if you choose someone who's
Right.
quality and is certified by the American Board of Plastic Surgery, then that's what you want.
Right. And the thing is, and I want to stress this, is that I think a lot of people just assume if a surgeon is doing that procedure that they are qualified to do it. But there are so many doctors that are not plastic surgeons. There's family medicine doctors, emergency room doctors, anesthesiologists. I mean, it's endless. And they're all doing breast augmentations. And
Right.
so, like you said, you have to make sure that they're board certified by the American Board of Plastic Surgery.
Right. So just because they're board certified doesn't mean
Or
they're
board
boarded.
eligible, but yeah.
Right. Board eligible. Right. But it needs to be plastic surgery for a body procedure like this.
Right. And cosmetic surgery does not count. That is not a board.
Yes.
Yeah. That is a
Yep.
pet peeve of mine. Yeah. But a plastic surgery.
It looks like there's one comment at the bottom. Can you read that? It went away for me.
Let's see.
A lift.
Yeah, lift versus implant.
Everyone's really different. Yeah, I mean, some people, if they have a lot of extra skin and their nipple is really sagging, then they need that lift. I mean, when you put that implant in, the chest, you want the nipple to be at the center point of the implant, at the center point of the breast. And if the nipple is hanging too low, it's just not going to look great. And it might look good for a little bit, but it's not going to give you a good long-term result. And your surgeon will be able to look at you and say, you need a lift, or, there's some things we can do inside to create just an internal lift that will just give you a little bit of a boost. And so obviously, this is not a decision you have to make. You need to see a really qualified surgeon, and they'll be able to look at you and tell you what you need.
Exactly. And then we have another question here about whether they are okay with pressure. I think that's I understood that correctly. And they are. You can like sleep on your
Oh
stomach.
yeah.
You can do what you normally do.
Yeah,
The only
push-ups,
difference is with
workouts.
saline implants, if there's a lot of pressure, they can rupture, and it's salt water essentially just leaks out. That's
Hmm.
really it. They're completely safe. They, you know, stay intact with mammograms, and there's a lot of pressure with mammograms. So,
Yep, absolutely safe to have that. I've only had one patient ever who had a rupture from a car accident where the airbag actually hit her implant. So it takes a lot of
it is
force to break
right.
them.
And I used to see them a lot in Boston, but they were always in patients that had implants for over 10 years, so
Hmm.
those implants were already
A little bit more
pretty old.
fragile.
Yeah,
Hmm. Hmm.
exactly. All right. Well,
Awesome.
we are over our time,
It was
but
great.
this was so much fun. And okay, there's another fat transfer. I think we should make it another topic.
I think it's a great idea. I think a
Yeah,
lot of questions about fat grafting to the breast. So we're going to do that as another topic coming up. So stay
awesome.
tuned. Awesome.
All right, you guys. Well, thank you so much for joining, Ash. I love seeing your face every week.
It's the best. It's the highlight. I love it.
Exactly. All right. Well, good night, guys, and
Ta
happy 4th.
Take care. Everyone have a safe weekend.
Bye.
Bye.